Welcome to T's Voices, telling the stories of the people in our NHS community.
Welcome everyone to the podcast. Today we have Carol Martin joining us today as the co-host. So welcome to the podcast, Carol.
Hi everyone, really looking forward to today's podcast, and I'd like to welcome our guest today from the Transfer of Care Hub. So today we have Becky Shea, who's the Strategic System Lead for Transfer of Care, and we've got Jeni as well, who's one of the discharge facilitators within the Transfer of Care Hub. I'd just like to start today with a question really to say to Becky and Jeni. Tell us about the Transfer of Care Hub. What do you do?
So, hi everyone. The Transfer Care Hub, or TOC for short, is integrated service that has been set up and it's been running now for the last couple of years since September 2023. And it's basically a service that's there that's fully integrated, multidisciplinary across both health and social care. And it particularly focuses around discharge pathways coming out of the acute environment of anyone who has a need. So when we talk about need, it's anybody that can't just go straight back home again, that they might need some support in their own home. They may need to go on for further rehabilitation, or they may also need support in terms of care home provision, etc.
Brilliant. Thanks, Becky. And in relation to the team, what professions are in the team? And Jeni, you're an occupational therapist by background, is that right?
Yes.
Can you tell us a little bit more about that?
Yes, so it's very much a multidisciplinary team, mainly made up of nurses from a discharge facilitator point of view, so from the trust side. But we have OTs, we have a social worker as a team lead, and we also work extremely closely with the social workers from Redcar and from Middlesbrough, and also the trusted assessors from the Redcar team as well. So we're all in an office block together.
Excellent. And how does that help? How have you seen that help the patients that you're working with, working together in that way?
I think we've seen a massive, certainly over the last 18 months, since September 23, we've seen a massive streamlining of services. So previously we'd do an initial assessment and then a social worker would come in and do their ongoing assessment, and they would take the case forward into the community. Now for Redcar Middlesbrough patients, we case manage from the start. So everybody does the same role in terms of managing that patient's discharge from the point of referral to the point of them being home or where they need to be. But we each do it in our own unique ways, and we get support from each other.
I was just going to add as well, Jeni, I didn't want to interrupt. I think it's important to say as well that it's standardised, so irrelevant of which different profession goes and assesses that person. The same assessment is done irrelevant of professional background.
Yeah.
So did that take a lot of training, upskilling? How did everyone get to the same level?
So there was a great deal of upskilling. So everybody came with their own professional expertise and came and brought their wealth of own experience. But in order for it to be standardised, and I think it's important at this point to say, it's when a patient no longer meets the criteria to reside. So that button is clicked on Maya, on the EPR, that feeds into the TOC hub. The minute that button is clicked, the TOC hub, the Transfer of Care Hub, start their work. They do everything they can to get that person's need identified via the trusted assessment documentation and assessment, and they process all of that to get that person out of hospital to the right onward place of care as quickly as possible and as safely as possible.
And in relation to the individual, what are the options for them? What services are out there? And also in relation to their families as well, because they'll have a lot of concerns around the person when they leave hospital. So what can you offer?
Offer anything from advice and support at the sort of very lowest level to Home First, which is an interim service that can go in, that can support somebody perhaps if they don't know what their needs are, but they know they need something. Then Home First can come in. The Home First service can also bridge until a package of care can start. People can go home with reablement, which is designed to bring a person back up to sort of reskill them, bring them back up to what we call their baseline. If they've been in hospital and they've perhaps, become unwell, and then we've got carers that will go in. People can go on to a further rehab setting, be that a community hospital or an alternative setting. Sometimes we have patients that need to go into a short-term placement just to have their further assessment of need or see if we can get them back home, because that's always our aim, is to get somebody back home as long as it is safe to do so. I think we all know if we've been away, whether that's in hospital, whether that's on holiday, whatever, when you come home, you always feel you're in your right place.
Yeah, and you've talked a lot about upskilling and independence, and that gives a quality of life, doesn't it? And people genuinely, when they leave hospital, they want to go home, don't they? So that sounds really good, and lots of opportunities there. Anything else you want to kind of share with us about the great work that you've been doing in the Transfer of Care Hub?
Transfer of Care Hub perspective, the team work very, very closely with family members, informal carers, as well as formal care packages and the wider care home community. It's important listening to what the person's needs are and what the person wants. We have a number of situations, a number of case studies that person just wants to go back home again. And the AHPs in particular are very, very good at assessing those risks and making sure that that person is going home, but is going to be safe enough to stay in their own home and avoid a readmission back into acute care.
Yeah. Thanks, Becky. I think you mentioned there about the AHPs, the allied health professions who are involved in the Transfer of Care Hub. Kind of and you've kind of touched on some of that uniqueness that you bring to that integrated team there. So what can you elaborate on that, Jeni, in some way?
Yeah, so I think, as an OT, I very much look at what somebody can do. So I use an asset-focused approach. I also it's integral what that person wants, what's important to them. Do they want to go home? Are they saying they want to go home because they want to be at home? Are they saying they want to go home because they know they want to feed their cat? Because that cat's really important to them, and that's become integral into their daily life. So I think just coming from that background as well of community work and of community-based sort of work, I perhaps would be less risk averse, but understanding that there are risks there, but making sure we account for that and assess for that and put the safeguards in place.
Yeah. Absolutely. And some people want to take their own risks as well, don't
yes,
they?
Yes, and just to add to that as well, from an AHP perspective, a role like discharge facilitation and working as part of that Transfer of Care Hub is a really valuable learning experience, as well as the wealth of knowledge and experience you can bring, but also what you can learn from it as well. And I think it would be really valuable for any AHP who was interested in maybe a slightly different avenue to explore rather than a traditional method opportunity that's out there.
Excellent. So it's been really good to hear about the great work going in the Transfer of Care Hub. Is there anything, I guess, two questions. What difference have you made? what difference have you seen? And also, what's your takeaway messages from today's podcast?
I think in terms of differences, if we take it right down to sort of numbers, if we think about 2.5 years ago, we were averaging about 140, 145 patients who were ready for discharge and were still in hospital in an acute bed. Now we're looking at a sort of 65 to 70% reduction on that. So our daily figures are around about the 45 to 50 mark on a bad day.
Huge improvement, which
massive.
is amazing. And that streamlining, doing things differently, that transformation that's taken place, and that integrated working and the trust that's being built up across organisations and professional boundaries has been significant in that, hasn't it?
Yeah.
Fantastic.
Take-home message, Carol, just to finish off, is if a ward colleague, a patient even, a patient's family, felt that there needed to be some support there on top of what's already provided from an acute ward perspective, it's getting the Transfer of Care Hub involved early, particularly when that person doesn't meet that criteria to reside, because there's a wealth of knowledge, experience and available options for onward movement. And that might be straight home again, or it might be onto another facility, another support mechanism to get that person back to as close to baseline as they can.
Yeah, absolutely. Brilliant. Great.
That's been an absolute privilege listening to you talk about the Transfer of Care Hub, because it's something really new to me. So thank you very much for coming. And Carol, thank you so much for co-hosting. That's been fantastic. Have you found it all right?
Yes, thank you. Yeah, I enjoyed it and enjoyed hearing more about the Transfer of Care Hub as well.
Thank you, everyone. Goodbye.
Thank you for joining us. Till next time, you've been listening to T's Voices.